So a person who gets them removed, you're saying, is that some individuals think, well, I'm going to feel tons better. And they may not, because you're saying like genetically, they may not have the capability, the capacity to detox what they've had in their body for so long. Do you find...
Barring the one I told you who was heating themselves up in a barrel sauna. Now that person had every single metal in a device shell basically on their tox report. And after I took them out and repeated that, they were all gone.
Oh, wow. Wow. Fantastic. Is there like on your subline, because they would ask, patients would ask, like, is there one major, I know everybody's different genetically, doc, I'm saying, but is there one detoxifier or one binder that you would say that works on most people like that to help with all that toxicity after somebody gets their explant surgery?
Yeah, we've partnered with Cellcore to start gentle binders initially, because some people just do not do well. They have such gut problems that, and, you know, I would say, you know, that is the most difficult thing to overcome are the gut issues. So they're so complex. And then I'll get somebody who was put on Accutane as a child, or they got rounds and rounds of antibiotics for whatever reason. And, you know, their brush border's not intact. They have leaky gut, and it's just like a total shit show to take care of them, because what you're trying to do is increase their protein content, especially after surgery. I try to get it beforehand. So I try to drop, you know, not a total caloric amount. I don't pick calories. I want grams of protein, because that's what your body really needs to recover. But man, the absorption of that is challenging for these patients. They have so many gut problems. So we start trying to work on that right away.
Yeah, those gut problems, I'll tell you. And there's so many things that feed into gut problems outside of just your implants. I think your implants can perpetuate a problem that's already there. So do you see women that have, like, they've already got an underlying condition? Maybe they've had exposures to mold. Maybe they've got, you know, a heavy toxic burden. Their liver's already congested. Obviously, the genetics and detox pathways, all of that plays a role too. But it's like their bucket is filled, and then they get the implants and they're like, oh my gosh, this just pushed me over the edge.